We are recording. Okay, hi. My name is Chloe Burke. I'm an RN and I am in my last semester of the RN to BSM program with the Mississippi University for Women. I'm going to be doing a presentation on mental health during the global pandemic COVID-19 that we're all pretty familiar with by now. I'm going to introduce everybody that's with us. So we've got Michael Burke, who is an RN. We've got Brantley Lake, who is also an RN. We've got Vicki Burke, who is a PA. Steve Lee, who is an RN, and Heather Simmons, who is also an RN. All righty. So we're going to start out with objectives. So the first one, we're going to go through how COVID-19 impacts different populations' mental health. We're also going to go through how it specifically impacts healthcare workers' mental health. And then we're going to go through some coping strategies for the mental health impacts caused by COVID-19. Alrighty, so we're going to go first through some impacts through the ages. So preterm, we're mostly talking here about like pregnant women. So concerns there are going to be concerns about the impact of COVID on the baby, as well as concerns about similar things like the COVID vaccines, how it's going to affect the baby, the mom, long-term, all of those things, as well as anxiety about delivery and hospital stays, isolation. I know a lot of hospitals are still only allowing like one visitor in, which is definitely different than women have experienced in the past. There is a lot of anxiety circulating around that. From 0 to 5 years, we're looking more at the home life, kind of coping with some big changes to their routine. You know, kids are usually used to getting up and having their routine, whether that's a stay-at-home mom or dad or going to daycare, but now all that's probably a little bit different, whereas they might be staying home when they used to go to daycare or going to daycare when they used to stay home, kind of vice versa. A lot of them have had to deal with isolation from friends, as well as kind of dealing with the impact of their parents' stress and coping and things like that. School years, we're going to go through kind of the same things, a lot of boredom, more of that isolation, which might be harder on them, who might be kind of having closer relationship with kids now, which can kind of lead to a lot of anxiety, depression. We're also getting into like teenagers, so being separated from their friends might be a big issue for them. And then we're still going through that parental stress and how that's going to affect them as well as big changes in school and stuff. A lot of them might also be homeschooled now where they weren't before, or vice versa. For working age adults, we're going to be seeing a lot of them out of work, or that they might be having to work from home, which is a huge change for them. Financial worries now, isolation for them as well. And then some increased anxiety about taking care of their dependents, making sure that they're okay on top of their own mental health, things like that. Retired age and our older kind of population is where we're going to see a lot of anxiety from isolation. These are people who might have already felt isolated before, but this is going to be even more now. You know, they can't get out to the grocery store as much. They're going to be asking their family to bring them groceries, things like that, which is going to give them more anxiety about being dependent as well. Financial worries, fears just about getting COVID, and things like that. Next, we're going to look at some impacts on the people who kind of were impoverished anyways before. If I can get out of this, I had a graphic to show y'all. So this shows kind of the different number of stressors. Those who were making less than 34,000 had a lot more stressors than those who had a household income above 150,000, which if you look at that, it's probably, you know, what you would think of anyways. But when it comes to the pandemic, we're looking at people who are increased in, you know, housing payments, you know, not making their rent, food insecurity, all of those things are just going to be increased during the pandemic. And so this just kind of shows how that was increasing during the pandemic, as well as that depression and anxiety related to that. Alrighty, I'm gonna pop back in here. Okay, so we're also going to look at some different populations, including those with autism or learning disabilities. This is something that people kind of don't talk about quite as much. But people who are autistic or have some learning disabilities might have even harder times with their mental health during the pandemic, just because of, we talked about changes in schedule, but their disruptions in schedule are going to be a lot more upsetting, lead to a lot more anxiety and things like that. They're now going to have a lot of social isolation. And when they would typically go to therapies, learning, things like that, they might have to do it online now, which just may not be super cohesive for them. So we have some tips for those adults who might be autistic or have some learning disabilities, as well as their families. So a big thing for them is going to be creating a routine, for resting, eating, recreation, just setting aside times for all of these separate things. Also limiting the amount of time watching the news. This is really just going to cause a lot of anxiety and just making everybody feel overwhelmed. Um, it's also really important to establish some good forms of communication. That can mean helping them connect on social media to other people who might have the same learning disabilities, other autistic people. There are lots of support groups out there. So just helping them figure those out, and then over the phone as well, making phone calls, helping them make phone calls, things like that, just so that they're not feeling isolated and alone, like a lot of us are in this whole situation. So last, we're going to go through the impact on healthcare workers. It's definitely caused a spike in various mental health problems for healthcare workers in all settings. So the first one, we're going to look at acute stress disorder, which is going to be triggered by like a traumatic event or something like that. It can leave the healthcare worker feeling super stressed out, just worrying, losing sleep over specific situations, which if this persists for more than a month, we're looking at PTSD basically here, which they are seeing an increase in. So PTSD, same thing, it develops after exposure to traumatic events. This is going to be a little bit more intense. So you're going to have these disturbing thoughts and feelings that can be triggered when thinking about this event. You can have flashbacks, nightmares. It can cause sadness, fear, anger, guilt, shame. It can cause you to be detached from others, all of that. And then the last one we're going to look at, which I think is what a lot of healthcare workers are experiencing, is this chronic stress, which is stress that is overwhelming and can't be resolved. So causes of this from relating to the pandemic can be fear of contracting COVID or giving it to others. I know that's a big fear. Understaffing causes a lot of stress, which everyone is dealing with now, and inadequate resources. And then just the newness of this all, we still don't know the long-term effects, which is really stressful for a lot of people. But this can cause problems with your relationships, your health, sleep. It can also cause intense emotions that can really just make you feel super overwhelmed, which I know a lot of people are dealing with right now. So some strategies for coping with mental health, really the biggest thing is just to reach out for help. Early intervention has been proven to make a big difference. Most people who work in like a hospital or a healthcare setting, there are resources. I know that ours, they have like helplines over the phone, and then they also will set you up. Ours sets us up with like a free like counseling sessions. I think like the first 3 are free or something like that. But I know that most people do have that. So if you're not aware of your hospitals or your settings policy on that, I would just reach out and kind of figure out. So if you come across, these mental health issues, or if you know somebody that, is struggling, that you can kind of give them these resources as well. And then just practicing self-care, writing out your thoughts in a journal, reading, listening to music, talking to friends and family, going for walks, just getting exercise, getting outside, those good things. And then just same, helping others, just check in with people, dropping off meals for people who are isolated. I know just helps people not feel alone and kind of helps with that overwhelming feeling. Alrighty, but that is mostly all I have for y'all. Does anyone have any questions about anything? Alrighty, well, thank y'all for tuning in. I really appreciate it.
Thank you.
I'll have a good rest of your evening.
Okay, you as well.
Thanks. Okay. I don't know if I turned the recording off.